Hello everyone, welcome to Healthy Living Videos. Today, I'm diving into a topic that's crucial for male reproductive health, the vasectomy. So, what exactly is a vasectomy? Simply put, it's a surgical procedure designed to provide permanent contraception for men. Let's break it down. First off, the basics. The vasectomy involves cutting and sealing the vas deferens, the tubes that carry sperm from the testicles to the urethra. This means no sperm will be present in the semen, making it nearly 100% effective in preventing pregnancy. But don't worry, this doesn't affect testosterone levels, sexual drive, or your ability to have erections. Now, let's talk about the procedure itself. It's typically done under local anesthesia and takes about 15 to 30 minutes. There are two main types, the conventional method and the no-scalpel method. In the conventional method, small incisions are made on either side of the scrotum to access the vas deferens. The no-scalpel method, however, uses a small puncture to reach the vas deferens, reducing the risk of complications and speeding up recovery time. Recovery is usually quick. Most men can return to work and normal activities within a few days, although strenuous activities should be avoided for about a week. Swelling and discomfort are normal, but can be managed with ice packs and over-the-counter pain medications. Now, about effectiveness and reversibility. While vasectomies are highly effective, it's crucial to use alternative contraception until a semen analysis confirms zero sperm count, which usually takes about 3 months. As for reversibility, vasectomy reversals are possible, but not always successful. So, it's best to consider a vasectomy as a permanent decision. Lastly, let's touch on some common myths. A vasectomy does not cause long-term health problems, doesn't affect your hormone levels, and most certainly doesn't affect your masculinity. It's a safe, reliable, and effective form of contraception for men who are sure they don't want to father children in the future. So, there you have it. Understanding vasectomy is crucial for any medical professional and health enthusiast. Make sure you consult with a healthcare provider to get personalized advice. Stay informed and keep making healthy choices. Thanks for tuning in, and don't forget to like, subscribe, and share.